Okay, shoulder flexion. I'm going to have your arm down to the side. What I want you to do is with your thumb up, I want you to reach all the way up as far as you can. Is that as far as you can go?
Mm-hmm.
Okay, I'm going to assess the infill of the glenohumeral joint with just a little bit of passive motion. Okay, now come back down to that starting point. You're going to palpate the acromion and the glenohumeral head. Find the most lateral aspect and place the axis of the goniometer at the most lateral aspect of the humeral head, still ensuring that that form is in neutral. And the stationary bar of the goniometer needs to be in line with the midline aspect of the trunk, and the mobile arm is going to follow the humerus. Now I'm going to have you reach up again. I keep my fingers on her arm to kind of keep the goniometer stable. You do end up translating that axis slightly to keep the axis in line with the lateral aspect of the humeral head. And then you take your measurement, it's like 172, and come back down. Now I'm going to ask you to do shoulder extension, and the back of this chair is in the way a little bit, so she's going to scoot. Forearm is still in neutral. Now reach back as far as you can. Is that as far as you can go?
Mm-hmm.
I'm going to give you just a little bit more pressure to assess the infill of that joint. Okay, back to the neutral spot. Just relax. Can you relax a little? There you go.
Sorry.
And I'm going to palpate again, finding that most lateral aspect of the glenohumerus, or the humeral head. Line my axis up. The stationary bar still is in line with the trunk. She's going to reach back as far as she can. And you're going to keep the mobile arm on the most centralized aspect of the humerus. And her motion is 43 degrees right there. Okay, and relax. Now we're going to do shoulder abduction, and I'll have to get behind. And I think this will be a good position. I'm going to keep you on the edge of your chair.
Okay.
This time it's important to supinate the forearm, and I'm going to have you bring your arm out to the side, reaching it up all the way. Is that as far as you can go?
Yes.
Okay. And I'm going to assess that infill with a little bit of passive motion gently, ensuring that her trunk does not move. Keep her forearm supinated. Okay. Come back down. This time, as you palpate to find your location for the axis, you do want to find the acromion, and then you're going to come inferior just about an inch, so that you're on the most posterior aspect of the humeral head. Your stationary bar is going to remain parallel to the spine and the torso, and your mobile arm is going to follow the humerus. Okay, so now I'm going to have you reach your arm out to the side again. And again, that humeral head will translate slightly vertically. You'll move your axis along with it, still keeping your stationary bar parallel to the spine. And your mobile arm is aligned with the humerus. And I'm going to read that measurement at 170 degrees. Now I'm going to let you come back down and relax. Okay, so now we're going to do horizontal adduction. I'm going to have her starting point be at 90 degrees of abduction, and to assess that passive motion, she's going to reach across, all the way across. I'm not going to step in front of the camera. Assess that end joint with a little bit of passive motion. Okay. Now we're going to palpate again that acromion. Sometimes it's easier to palpate the acromion a little bit down, then come back up. You're still going to align the axis of the goniometer this time over the most superior aspect of the humeral head, and you're going to keep your mobile arm following the humerus. Now I'm going to have you reach across the front of your body again. And you're going to take your reading, about 117 degrees, and come back and relax. Return to your position. External rotation. Best practice is to measure external rotation with the humerus abducted to 90 degrees. If your patient is not able to achieve this position, you can take a measurement from when the humerus is adducted. But we're going to first of all start out here. You're watching to make sure their posture is in good alignment. Can you bring your hand up in the air, making sure that this elbow does not drop down? If she's translating down, then you're not going to get a good motion, or you're not going to get a good reading. So let's go back to the center. And, well, yeah, go ahead and go there. And you can assess passively to get that end feel. Good. Okay, now we're going to take a measurement. Can you hold it right there? Mm-hmm. You're going to align the axis of your goniometer with the olecranon, the most centralized aspect of the olecranon. You want the forearm to be parallel to the floor. And now you're going to bring that hand up again, keeping your mobile arm aligned with the lateral aspect of the ulna. And you've got to coach them not to let that elbow drop down. She has a good 88 degrees of external rotation. Now come back to the center. And I'm going to go ahead now and do internal rotation. She's going to drop her hand down. I'm kind of giving her a little bit of support here because now I'm going to assess that end feel of the joint passively. Now, hold it right there. Your axis is aligned exactly the same. We need this forearm parallel to the floor. Now I'm going to ask you to do that again. Drop your hand down, keeping your elbow in that same spot right there. Let's say she's got 48 degrees of internal rotation. Okay, so if we are going to measure external and internal rotation with the humerus adducted, you might want to use a smaller goniometer because it helps eliminate interference with abdominal tissue. So you're going to still align the axis of the goniometer on the most centralized aspect of the olecranon. Your stationary arm of the goniometer is going to remain resting in an anterior direction, and you're going to keep the mobile arm aligned with the most lateral aspect of the ulna. Is that as far as you can go? There you go. And I'm going to go ahead and remove it to take that reading. You can relax. I've got her at 54 degrees of external rotation there. Now, if we're going to reposition, you're going to have the same position for internal rotation. It's not as reliable because the abdomen gets into the way, and I lost the olecranon there. That motion would be almost 30 degrees of internal rotation. Okay, let's do elbow. We'll go ahead and use this goniometer. We're going to measure your elbow extension. So you want to go ahead and assess that passive motion. The infill should be hard, and you're going to line up your goniometer to palpate. The goniometer is going to be at the lateral epicondyle. I like for the forearm to be in neutral because you can palpate that lateral epicondyle much easier. Then you're going to have the patient supinate, that reconfirm your alignment where you're going to align the axis of the goniometer by keeping a good palpation of the lateral epicondyle. I'm going to have you do that one more time. Neutral. There's the epicondyle. Now turn your palm forward. Good. Your stationary arm should stay on the lateral aspect of the humerus, and your mobile arm is going to line up with the lateral aspect of the radius. Now I'm going to have you bend your elbow like you're going to touch your shoulder. Good. This goniometer is just a little bit long. It's running into her thumb. And I've got her at 145 degrees of elbow flexion. Now come back straight. And her extension, I should have measured that first. Extension is probably like, we'll go ahead and say 0 degrees. If she had any hyperextension, if her elbow went back, then you could take a measurement for hyperextension and note that. Now let's move to forearm supination. So I'm going to have her humerus still adducted to her trunk. And if you're concerned about, that's important, if you're concerned that they might cheat or move their elbow away, you can ask them to hold that towel close to their trunk. So I'm going to scoot over here. I like to be in front of the patient and get my goniometer aligned. You want to find, you're going to palpate the ulna. You want to find the head of the ulna and the styloid. Also, you're going to align the goniometer on the volar aspect of the wrist, just proximal to that ulnar head. So I'm going to set my goniometer right here. I'm almost in the way of your leg. Am I proximal to it? No, you're good. Okay. And you're going to keep your mobile arm perpendicular, your stationary arm perpendicular to the floor. Now I'm going to have you turn your palm up and this is a skin surface measurement, so you're going to move the axis of the goniometer upwards so that you can lay the mobile arm of the goniometer flat on the volar aspect of her forearm, and then you will take your measurement there, which is about 82 degrees. I neglected to test her infill of the distal radial ulnar joint. So prior to that, you would want to assess that infill.